Okay. Yes, you can start.
Okay. Please tell me if you can hear and see me well. So then probably we will start, even if somebody will join us later. So if you don't mind, we can start. And probably at the end, when I finish, after explanation, how everything goes on with diabetes type 2, then we will have some clinical story of patients who were treated in our clinic and what results they've got. And of course, you can ask your questions. I'm sure that you will have some of them, and I will be ready to answer these questions at the end.
כאילו זה על 22.
אורן, חכה, תדבר גם וגם. I have a patient here who's also asking if you can explain a little about diabetes type 1.
Okay. Well, you see, if we start talking about diabetes in general, it is, of course, it's a group of chronic diseases, and they are connected with the insufficient production of insulin, or it can be another reason when the body, when the tissue doesn't allow glucose to go inside the cell. So let's say in our vessels, in the blood, there's a certain parameter, roughly 3.3, 5.5 millimole per milliliter. And it should be these strict parameters. And when something goes wrong, then we know that glucose is increasing in the blood. So mostly diabetes mellitus is the name for the group of diseases which have two main bad mechanisms, pathological mechanisms. First of all, connected with insulin production. This is diabetes type 1, and it can be bad taking of tissues, bad let's say, bad metabolism of tissues that doesn't allow glucose going inside. In medicine, it is called insulin resistance, and this is a common characteristic of diabetes type 2. So with diabetes type 1, which you asked me, this is a problem with pancreas gland, mostly with beta cells which produce insulin. And because of, let's say, mostly autoimmune aggression, for it can be many reasons, then own immune system starts to attack these beta cells of pancreas gland. And finally, it leads that these cells are killed, they are damaged, and they don't produce insulin, and people have usually this diabetes is common for young people, even for kids, unfortunately, and with some kind of serious problems with coma or some kind of acute episode, these people can get into the clinics, and then high level of glucose these people can have. You see, so this diabetes type 1 is for sure connected with the low, reduced insulin production. And autoimmune aggression for beta cells, this is a reason. Sometimes it can be after infection, sometimes after, let's say, stress or, you know, some kind of things, but usually scientists consider that there is certain predisposition in the body, genetic predisposition for diabetes type 1. And when some additional factors appear, for example, stress or, as I mentioned, infection, then it can, this predisposition develop and finally this type 1 this disease appear. And here you see that there are many other things except two main common problems, diabetes type 2 and diabetes type 1. There are other genetic reasons for having these problems for diabetes. And for sure, we should remember that with diabetes type 1, it's very important for these people to have good control of glucose. So to check the amount of carbohydrates we eat and the level of glucose constantly, what is going on with the blood level. So that's why for these people, it's important to control it, because if not, then it will be the burdening effect, the burning effect for vessels, and finally it will lead to complications. And about these complications we will speak a bit later. So the solution for patients with diabetes type 1 is insulin. If a body doesn't produce it, then only insulin injection or insulin pump can be the solution. Two things, nothing exists at the moment anymore. And the stem cells, of course, if it is the beginning of the problem, it is good. It can, let's say, help to just minimize this autoimmune aggression, but it will still in process. And finally, all beta cells will die, unfortunately. So at the beginning, diabetes of the diabetes type 1, stem cells can make this onset be longer, not so quick with fast aggression. And if it has already developed, then stem cells will help with preventive therapy of complications. Does it make sense a bit?
I want to make it clearer. Mm-hmm. So you are saying, from what I understand, that if we catch the disease in the beginning of the process, if we take stem cells, they will make the process be slower. They exactly. Can make the process to need insulin slower. But in older patients who already have complications, stem cells can treat the complications of diabetic people.
Not, let's say, treat complications, but also control and slow down their further development. And if it is the beginning of problems, it can be some kind of reverse of the problem. Do you understand what I mean? So again, what stage of complications we are facing? If it is the beginning, we can have good control and even reverse of the complications. If it is last stage of vision problems, kidney problems, or neuropathy, erectile dysfunction, then unfortunately nothing serious can be done, nothing significant.
So in what point does a diabetic patient need to come to the clinic?
Well, the best thing is at the beginning, when it was diagnosed recently, it is good time to come. And when we are speaking about the beginning of complications development, because sometimes it can they can develop, let's say, after 5 years or 7 years after the disease, but sometimes in a shorter period of time. It depends how well the diabetes is under the control. And if they are developing, then the beginning of their appearance, then it's also good time to have the stem cells therapy and to support the body, to prevent complications development.
Okay.
Okay, so probably a bit later it will be better. better to understand what I'm talking. So main thing is problems with insulin production and problems of getting glucose inside the cell. Here you see this mechanism, the yellow button, yellow button on your left is insulin, and when everything is good, it is connected with insulin receptors, and a glucose channel, a green one, is open and glucose goes inside. So this is main mechanism. So insulin helps to unlock glucose channels, This is normal reaction, and these violet circles, glucose gets inside the cells, and this is the normal functioning, normal metabolism. But when, like we mentioned before, insulin is not produced enough, this mechanism is broken, and then there are plenty of these violet circles of glucose, which is in the blood, and we have increasing, not 5.5 roughly, but it can be 10, 12, and even higher amount. And for vessels, it is burning, constant burning, and trigger for inflammation of vessels, of capillaries. So let's continue. This is normal functioning, normal production of insulin. It is connected with insulin receptors, and glucose gets inside the cell. Okay, now we will focus on diabetes type 2. What are the common characteristics for this type? Mostly it is the diabetes which happens in adults, and let's say after age 40, 45, this is quite common cases. This type is called non-insulin dependent or adult onset diabetes, and it's connected when body cannot effectively use the insulin. So the production is okay, pancreas is functioning good, but body cannot effectively use this insulin. In medicine, it is called insulin resistance. And of course, this disease is also connected with the excess of body weight, when people have obesity, and when they have lack of physical activity. So these are also common things for patients with diabetes type 2. We should say that disease cannot be revealed for many years, because the symptoms are not so, let's say, marked, in comparison with the diabetes type 1. So very often it can be diagnosed unexpectedly while having the lab test for glucose level. Okay, so this disease can be developing for years even. And now at the moment, unfortunately, there's also tendency that this type can occur not only among adults after 40, 45, but now it can also happen with small children as well, which wasn't common in the past. And the statistics and epidemiology is very severe. It is very serious. And according to it, in 2040, 1 in 10 adults will have diabetes. So it's, let's say, if to take one class with children, for example, 30 children in the class, it means that there will be 3 kids who can have this serious problem. And it is a constant growing of this problem. there are many factors for this reason, and even every year 1.5 million deaths happens because of diabetes and its complications. Well, so the if to summarize it, let's say as complications, more about 500,000 patients will have kidney problems. So they are candidates for dialysis, and diabetes is the main trigger for this serious problem. And of course, it's also because of vessels problems with tiny vessels with capillaries. It is in 20%, it is a reason for cardiovascular diseases. I mean, stroke. And in fact, these people are in a risky group, unfortunately, in comparison with the people without diabetes. And we told that the mortality rates because of this problem is gradually increasing from 3% to 13%. Okay. And we should say that probability of dying from one of any of four main diseases: cardiovascular diseases, cancer, chronic respiratory diseases, or diabetes. So this disease very soon can dominate among these problems, yeah, and is becoming a global problem. Okay, so if we look at into the mechanisms how it happens, so pathogenesis of diabetes type 2, as we told, the glucose doesn't go inside the cell because of insulin resistance. And it means that cells, they are starving. They don't have this glucose. It doesn't go inside the cell, and that's why cells, they make special signals that can make the problem more and more serious. Yeah, and first of all, starving cells cause the liver to produce even more glucose because they think that it's not enough glucose in the blood, and this is the reason that it doesn't go inside the cell. But the mechanism is a bit different. We are speaking about insulin resistance. Tell me, please, does it make sense or it's too complicated? Then probably I will not go deeper into it. Tell me, please.
Someone who is not a nurse? Anyone?
Can you ask again the question, please?
Yeah, I asked, is it too complicated to accept this piece of information? Then I will speak in general about main facts. I want to know your opinion. Should I go deeper into some mechanisms or not?
That was clear.
Okay, thank you very much.
Yes, it is okay. Yes.
Okay, good. So now let's look at the main things that we are facing. This is so-called hyperglycemia. It means high level of glucose, higher than 5.5, and insulin resistance that can cause other tissues to react, and liver starts to produce glucose, muscles stop reduce glucose uptaking, and other process in fat tissue can happen that increase producing of glucose. So the problem is making more and more severe. And the criteria for diabetes, you can see, is there are three main criteria, yeah, about telling about diagnose. This is, I do apologize. This is hemoglobin glycated A1C level. I do apologize. And if we do this test and have more than 6.5, it is a problem that indicates about diabetes. Or another thing, fasting glucose level. And it should be measured only in lab conditions. And if it is, let's say, higher than 6.4, yeah. But normal glucose should be, of course, lower than this parameter. And glucose tolerance test, that normal thing is 5.7, lower this parameter. If it is higher, then it is a problem. So let's say 3 main criteria, parameters that will indicate about the problem. And A1C level, probably you heard about it. It is the average data of glucose in the blood last 3 months period. And for patients with diabetes, it's common parameter that they can repeat every 3 months and can say that, okay, it was good control these 3 months, or if it is high, then it means it was a bad control of glucose level. A1C level, it is called. And fasting glucose, fasting blood sugar level, and glucose tolerance test. When we should think that something is not normal and that should force us to do something and to do this test even. It is like, let's say, potential warning signs of diabetes. First of all, it is frequent increased urination, yeah? And then it can be quite often and long-lasting infection of, let's say, of bladder and of all urinary tract, yeast infection as well. Of course, when people feel that they are very exhausted, when they start losing the weight and have intense hunger or feeling that they are thirsty. So easy to remember, frequent urination, frequent desire to drink and to eat, tingling or numbness in extremities. It's a sign even of complications of neuropathy of diabetes. And when you notice that the speed of healing of wounds or in gums very slow, then you should also think about possibility about high glucose and having problems with the glucose level. So these are things that should make us think about lab tests to do and to check if everything is good with main parameters, with the fasting glucose level, with A1C level, to say if you have in the group of pre-diabetes or even diabetes. So typical patients with diabetes can be a bit overweight. They can have problems with the liver. So liver enzymes, it's also necessary to check. High blood pressure, these categories have a tendency to have high cholesterol level because of obesity, and it can be problems with sleeping and with mood, low level of energy and high level of feeling exhausted. Again, it is bad mood. Then erectile dysfunction, man can face this problem because of suffering of capillaries, problems with the digestion and depression. And these uncontrolled things with glucose, I told that constant, let's say, burning and making vessels constantly inflamed, finally can cause complications. And these main organs which are suffering, first of all, it is vision problems and so-called diabetic retinopathy, and even it can be macular edema, cataracts, glaucoma. Then it goes, if we go clockwise, it can be heart problems, yeah, because of these vessels suffering, kidney nephropathy, diabetic nephropathy, and even it is called diabetes-induced kidney disease. So this problem can be the trigger for kidney problems as well. Nerves, peripheral nerves suffering, so-called polyneuropathy, because of nerve damage. With teeth, I mentioned about wound problems, and with gums, it is also things when long-term inflammation can be that can make you think about these problems, yeah, connected with glucose. And of course, brain also suffers, and cerebral vascular disease can finally appear, or these patients with cardiovascular problems are in a risky group for stroke and infarct. So actually, all main organs are suffering, yeah, and first these changes can be reversible when it is the onset, and we told it's better to do the therapy at this stage, but when it is the last stage and people are absolutely blind, or if today or tomorrow they should do dialysis, and if they have cardiovascular or cerebral vascular problems, then these are serious things, and unfortunately they cannot be reverse of these serious problems. Well, and another thing, if patients have this problem, something should be done. And these three main steps to help the body to minimize the level of damage, to minimize the high level of glucose. First of all, it is diet, normalizing the weight. It is moderate physical activity, and of course medications that can support the body and help the body. And when we speak about healthy food, here I'm sure that you know about all these things, and we should say that vegetables are good, except potatoes, except French fries. All other vegetables are good. Every day you should have fruits with different colors on regular basis. If to speak about oils, the priority should be given to healthy oils such as olive oil, canola oil, and to use it for dressing with salad. yeah, and of course minimize amount of butter and avoid trans fat. For drinking, avoid please the drinks, sugary drinks, and focus on let's say such drinks like fresh, yeah, without sugar. So juice can be on regular basis, and 1-2 servings per day with milk, yeah, and tea or coffee without sugar. And variety of whole grains are also important, and preference for the whole grains food, yeah, pasta or let's say brown rice, they should be just used more frequently. Okay, and as well, healthy protein. Here it is mentioned about types of special types of fish, beans, nuts, yeah, and limit red meat, cheese, and avoid bacon and other processed meats. Well, exercising at least 30 minutes on regular basis, moderate intensity should be, and of course controlling the weight, yeah, and trying to normalize it according to the height of the patient, age, yeah, then this final, let's say, ideal weight you should have. Well, among medications that can help with normalizing glucose, of course, with certain stages, last stages of diabetes type 2, even insulin can be as a solution, and they can be different types of insulin with very rapid reaction, intermediate, long, short reaction, and at the moment there are more than 9 different types of oral tablets that can help to control and reduce glucose resistance. Most common, probably you heard about it, is metformin. That is used all over the world, this medication, but there are many other groups. Sometimes even people can combine not only 1, but 2, even 3 medications, and plus insulin injections. And except these medication support, here I should mention that regenerative therapy is very promising and gives good results. At the end, you can see it, that this kind of therapy can also in a natural way reduce insulin resistance and helps glucose, those violet circles, go inside the cell. And plus we use not only the stem cells therapy, but so-called IMR treatment, intracellular metabolism recovery. We will speak about it also today. Physiotherapy, using balneotherapy, especially for patients with overweight, that helps to reduce weight, and as well certain things we recommend that can help to change the lifestyle and to have a physical activity at normal level, and taking food with wise and proper approach. So we came to the stem cells therapy. What is this kind of therapy is? At the central part of the picture, you see a brown cell, which is called mesenchymal stem cell. This is a unique cell that can give the beginning of any tissues of our body except blood cells. So these cells, let's say, regulate our constant regeneration of our tissues and with its own speed. For example, the epithelium of our intestine, these brown cells on the 12, yes, if we are speaking, we can compare with watch. So these epithelial cells of intestine, they have speed of regeneration in our digestive system about 7 days. So it means that every 7 days, these cells are renewed and it is under the control. And at the same time, our bones, so-called osteoblasts, our skeleton can be renewed completely within 10 years. So for each type of cells, there's own speed of regeneration, but all tissues have this speed. And you see that these cells can finally become the fat tissue or muscle tissue or cartilage or liver cells, fibroblasts of skin, or even neurons. Here, there's no only blood cells, because hematopoietic stem cell will be the precursor for that types of cells. And here it is mentioned that these cells are multipotent cells that can differentiate into a huge variety of cells. By the way, in our body, we have more than 200 different types of cells. And these mesenchymal cells we can find actually almost in all tissues. And the easiest way to obtain, to get them, is from adipose tissue, from fat, or from bone marrow, or some other sources can be used. And there's a certain classification of types of the stem cells that we use. They are called at the first stage of the child's developing, of embryon developing. They are called embryonic stem cells. So from conception to 8 weeks of developing, then they are called fetal stem cells until they develop until the moment of the child's birth. And when the child is born, the main source that we use for patients in our clinic are they are called adult cells from placenta, from umbilical cord. These types of cells we use, and they are called multipotent. So they can differentiate into huge variety of cells. So we use in our clinic adults mesenchymal multipotent stem cells. And how these unique stem cells work. Here we can see 4 main mechanisms. First of all, they can differentiate themselves into any cells except blood cells. So it can be like mother cell, which can finally, after many stages of differentiation, turn into neural cell, to neuron, or to liver cells, so-called hepatocytes, or any other, or cartilage tissue, or muscle tissue. Another way of mechanism is so-called effect that directly to the problematic areas and start controlling the regeneration in this area. Yeah, so it can be let's say especially in connection with capillaries, even go via the layer of vessels, and can influence the adjacent tissues. They can activate their regeneration, let's say, to be like a conductor, the conductor for adjacent tissue and control everything. And let's say it's a trigger for new vessels to grow, to improve metabolism, to have a longer life of the cells which are near, so they support adjacent tissues in maximum way to fix for the shortest period of time, to fix the problem and to solve the injury which happened. The third way of mechanism is influencing immune system, and stem cells are immunomodulating cells. So if it is immunosuppression, they can make immune system higher, more active, and with, on the contrary, autoimmune aggressive diseases such as multiple sclerosis, by the way, diabetes type 1, then they try to suppress immune system, and then it is a mechanism how we make the progression of the disease slow. Yeah, how we make it by controlling the cells of immune system. I mean, natural killer cells and regulatory cells. So they try to adjust immune system at a proper level. And of course, the fourth mechanism is trophic effect by producing different factors, trophic factors, growth factor. These factors can easily go with the blood flow and directly to these damaged areas and repair. So with trophic factors, it can be done also very quickly and properly. Here you see on your right the picture of of Greta Thunberg. This is a Swede, very famous person who supports the ecological problems and tries to solve them. And to a certain extent, it is like an example. It is how the stem cells works. When it knows with signals that there is a problem, there is a damage in the body, any problem. So mostly it can go to this area by homing effect, like magnet, it goes there, and the stem cell tries to fix this problem. And this girl, Greta, she, for example, when she found out about turtles problem, she went to that area. She helped people, informed them what to do to save these turtles. So like clever cells, she went there and tried to fix ecological problems. Probably it's a kind of comparison with the stem cells, that it goes to the place where there is inflammation, where there is a damage, and try to fix this problem. So we now we will speak about mesenchymal stem cells and stromal vascular fraction as a source for the stem cells. So these stromal vascular fraction is obtained by mini liposuction, usually the easiest way. If the age of the patient is good, regenerative capacity of the body is good, so adult can be the source for the mesenchymal cells from fat tissue around navel. It's a source for these cells to take, and after centrifugation, this stromal vascular fraction is ready for using locally or as intravenous infusion. So this mechanism you can see first mini liposuction, then this tissue this tissue, the mixture of it, is centrifugate, and on the bottom of the tube you can see that the layer with stromal vascular fraction with the stem cells can be found, and the specialist uses it, extract them, and then locally it can be administered or on a systemic level as IV infusion. So locally, I mean, very good effect with cartilage problems when it is administered into the cartilage, or even with vision problems, retrobulbar injection behind eyeball area or behind ear, or even as IV infusion. This nourishing things will activate regeneration of the whole body, and we can achieve general systemic positive regenerative effect. It means to renew all tissues, lungs, liver, kidneys, etc., all organs, all tissues. So, as I told, the injection can be done locally and into the blood flow, and the same day it can be used, or a certain amount of the cells we can leave for harvesting and for future needs, because stem cells can be frozen for decades without changing their properties. So this mixture, this mixture of tissues with at the bottom that finally we took, stromal vascular fraction, it contains many types of cells, including, first of all, green one, mesenchymal stem cells, smooth muscle cells, also cells of immune system, monocyte macrophages, regulatory T cells from immune system, pericytes, and endothelial progenitor cells that will help to form new vessels. So let's say it's a mixture, and most important variant in this mixture, of course, mesenchymal stem cells. And except these cells, there are also other trophic factors with growth factor and other biologically active components. And another slide will show how stromal vascular fraction works, how it works if, let's say, we administer in a local level this stromal vascular fraction. It helps to intensify the speed of wound healing. First of all, new vessels grow. You see the word angiogenesis, like the root of the trees. New vessels will grow in problematic areas, and new vessels means better circulation and better functioning of the tissue. So of course, additionally, such benefits we can have that neuromuscular conduction can be better, and producing of special active components such as chemokines and other factors that will stimulate tissue reparation process, and as well anti-inflammatory immunomodulating effect. And the speed of wound healing is much faster. So stem cell, another example, it's like a conductor of all tissues to be renewed, to be reprogrammed, to function better, to have longer life, And as well, many patients ask us about safety, yeah, of stromal vascular fraction. We can tell that this material is used for a long time, and it has shown a safe profile with no risk of cancer transformation and unwanted tissue differentiation. So these type of cells, there's also links for these articles. There are plenty of them that you can read and be sure that really it's a type of tissue of stem cell that can be easily obtained, used, and it is a safe procedure. And of course, many patients can have this procedure on a quite good tolerated level without absolutely any reaction. Of course, our specialists help to monitor condition, yes, of each patient, and to observe safety of the procedures and achieve all maximum beneficial results. Yeah. Well. When as well, if there are some situations when we can't use stromal vascular fraction, or if we want to have a higher effect, we can use donor's material as well. And the source for the donor's material can be after birth, that we use umbilical cord or Wotton's jelly and placenta as a main source of mesenchymal stem cells from a donor. Yeah, from a donor. And these cells also can be used for different situations, including diabetes, type 1, type 2. And if, for example, there can be some peculiarities or difficulties to obtain bone marrow or adipose tissue, or if we want to make the higher effect of the combination of the stem cells. Yeah? And for example, we need, it's absolutely non-invasive way to non-invasive therapy when we have ready donor's material. And again, on a systemic level as IV infusion, intravenous infusion, or on a local level, they can be done. And for sure, the priority for these cells we have when there's high risk of bleeding or some kind of contraindications for anesthesia for patients, so can happen. Or if patients take blood thinners for long period of time, and again, it's a risk of bleeding to obtain own stromal vascular fraction, or there's another pathological process in the area of taking the material. So it's like a solution. Allogenic stem cells can be helpful in these situations. Of course, these cells can be infused without any kind of invasive procedures for the patient. And placenta tissue-derived stromal cells are the youngest and can have a higher level of potency in comparison with the other sources. Yeah, we should say that in spite of our wish, we are aging, and when we appear, when we are newborn children, the amount of the stem cells is high. So it can be one stem cell in each 10,000 other cells. When we are aging, when we, let's say, the age of 30, then it is only one stem cell for 250,000 of the other cells can be found. And after at age 80, only one stem cell in 2 million of the cells can be found. So we see that gradually, gradually the amount of cells is reducing. And after 45, 50, regenerative capacity of our body is really very low, and there's a higher sense to use healthy donors material with high regenerative capacities. I mean, using donors material from umbilical cord and from placenta. Of course, sometimes immune reaction can happen. And to avoid these reactions, we should use the serum-free culture medium or autologous serum to minimize reaction from immune system. And sterility testing should be done, and PCR test for checking if there is any kind of infection or not in this material. So several times, according to European standards, the material is checked, okay? And these certificates are given in the clinic, which shows when the tissue was collected, percentage of viability, how many alive cells are in the sample, when it was frozen, and amount, of course. Several words let's mention about exosomes. Some people who had consultation with us, we showed similar pictures and telling that exosomes, these are vesicles or membrane particles of the stem cells. Yeah, it is like vesicles, green tiny vesicles which stem cells produce, and they are secreted by the cells into external environment, and with the blood flow can travel along the body. The functions of exosomes are transmission of signals from cell to cell. So it is a kind of communication, yes, natural communication. They can regulate and modulate as well immune response, like mini stem cells. And in these vesicles, different building materials for regenerative tissues can be received. So lipids, I mean proteins, even different nucleic acids, DNA, RNA, and mitochondria, energetic factory of each cell, can be delivered with the exosomes. Yeah, and these cells don't have genetic information inside, and that's why they cannot be replicated. Yeah, and their using is much more even safer in comparison with use of living cells. They are very popular in the United States, and they cannot transform into malignant cells because they don't have any kind of genetic nucleus inside, yeah, and they cannot transform into the harmful cells. And they have less likelihood to induce any kind of immune response or immune negative reaction. Yeah, and of course, because of the size, they can much more easier circulate through the body and even penetrate the blood-brain barrier. Several words about IMR treatment, what it includes. It's abbreviation for intracellular metabolism recovery. So this kind of therapy that helps to normalize metabolism. to have sufficient amount of antioxidants, antihypoxants, and we use this therapy, let's say, like nourishing the body with necessary building elements. Of course, it includes amino acids, vitamins, and with blood stream, with blood flow, they can easily go to all tissues and mostly to problematic tissues, and together with the stem cells can bring higher results. Yeah, and as for mitochondria and improving mitochondrial breathing as well, the intracellular metabolism recovery therapy can do it, and let's say give also more energy to the cell and to its functioning. So this kind of therapy provides normalizing of mitochondrial function, increases insulin sensitivity. If to return to diabetes type 2, it protects membranes from damage, reduces effects of toxic substances from heavy metals and other poisons things, and they provide cells with the potential to repair themselves at a better speed. Of course, when we speak about final results with certain patients, one patient's story I'd like to share with you. This is a man from the United States. A bit later, yeah, you will see his face. And finally, the results after this combined therapy, we have like this. We see the reducing of insulin resistance, and finally it leads to improving all parameters, including A1C level. Average A1C level in 80% of our patients is reducing for 6%, which is good. The average glucose level after treatment is closer to 8, yes, millimole per liter. So it's quite good results, yeah, in comparison with normal people. Now, after having 10, 12, even higher glucose level. Of course, this combined therapy helps to reduce the medications that patients can take, 2-3 medications, and so the dosage can be lower, and amount of medications we use. For sure, patients have improvements with lipid profile, better blood pressure results, and the reducing of liver destruction markers that will cause fatty liver. Such results are achieved in the clinic. And as for the amount of patients, there were more than 300 patients with diabetes during last 5 years, and 50% of all patients could notice the first effect of the therapy after even 1-2 weeks. And of course, more noticeable results can be seen after 3-6 months period, when the activity of the stem cells is at a higher level. And duration of the positive results can be 1.5, even 2 years. Of course, we don't forget about physical activity, about diet as well. Here is a patient, Joseph Anthony Jerez from the United States, who came to clinic in Moscow. If I'm not mistaken, it was even about 5-6 years ago. He came with diabetes type 2, obesity, and he had last stage of chronic kidney failure. So it was the 5th stage. And other problems, high cholesterol level, he had high blood pressure. Now, after, of course, he had the combined therapy with stromal vascular fraction. And after, let's say, the therapy, it was a trigger for renewal, for changes. And finally, this patient started to lose his weight, and he normalized his cholesterol level, blood pressure. And unfortunately, he came too late to help him greatly with kidney functioning. And we could, let's say, delay his dialysis. Later, he started dialysis, and then he had kidney transplantation. And it was good without any side effects. And I should tell that even now, he came for the therapy to Belgrade Clinic, to Serbia. He came because to achieve anti-aging, to restore his body after kidney transplantation. And this is also the answer when to do the stem cells therapy. Of course, when we have not the last stage. The efficacy, of course, is low, but still many benefits he had additionally, and it could be better for him if he came, for example, when it was only the beginning of kidney problems. But yeah, we had what we had. So as for main parameters of diabetes, it was really good results. We can tell about complete cure of diabetes type 2 with normalizing glucose level. And now he doesn't take medications for diabetes at all. He has normal weight and following the diet. And he is in a pretty much good condition. And by the way, if any one of you would like to talk to him, he's in clinic right now, we can organize it. I can share with Shira his American telephone number, and via WhatsApp, you can contact him. And join him, follow him in Facebook. He's a very active person as well. And he is an American actor. Well,
is it possible to ask a question?
For sure, Mr. Lior.
Okay, just I have a general question, not regarding diabetes, but a general question regarding stem cells and especially mesenchymal stem cells. You talked before about the ability of those cells to become any tissue, including neurons. And I know that in a lab condition, if you add some proteins, they can become neurons. But from my understanding, the action in the body is those cells are not becoming anything. They are just having those growth factors. They have anti-inflammatory and immune modulating properties. And they are, from what I understand, they are not actually stem cells, but rather than they are stromal cells. And the question is, from what I see, okay, from the, let's say, the top researcher in the world, including CIRM, which is a research center in California, with very big amount of money invested for researchers. They are using not only those kind of cells, but other kind of cells. There are many kinds of cells that can be used for those purposes of trying to investigate or research how to, I will not say cure, but make better some of the diseases. For example, there is something which is called neural stem cells, which is produced from iPSCs from induced pluripotent stem cells. There are also something which is called natural killer cells, NK cells. What my question is, there are many types of cells, and from my understanding and experience, it seems that mesenchymal stem cells, okay, they have some properties, they can make some changes, but the thing is, usually it's not enough. It's just like it make like little improvement or medium improvement, but it's not something which make for most of the people large improvement. And my question is, why are you focusing only on those cells? Because there are many options. Is it because of that you have only license to use those type of cells? Or is there any other reason? And my other question is regarding those exosomes. From my understanding, there are some clinics like your clinics in the world that produce mesenchymal stem cells from the umbilical cord. And they are also producing exosomes. And they tested it on, let's say, people usually, they are also treating children with neurological problem, but they are also, most of the patients, they treat people who suffers from arthritis of the knees, of other parts of the body. And when they tried exosomes, from their investigation, they told me that they noticed that the effect is only temporal. Let's say it's a relief for 3 weeks, 1 month, but when they treat with the mesenchymal stem cells, it remains like for years. So just a question whether you tested it separately, just exosome without the mesenchymal stem cells, are they effective? And also from another investigator in Israel, from what he says regarding the treatment of exosomes in children with autism, when I try to confront him and ask him regarding the exosomes that alone, I don't believe that they are beneficial, he actually said that they are adding some proteins, so they are doing something for the exosomes, so it's not just giving naturally the exosomes. So these are two questions. One is, why are you not investigating other type of cells which can be more powerful? And the other one is, do you think that exosomes alone, or did you test only exosome treatment to isolate and verify whether exosomes are really effective regarding long term?
Mm-hmm. Thank you very much. Very interesting questions you have asked. So as for our lab capacity, at the moment we can't do guiding of the mesenchymal cells to follow, for example, B neural cells, yeah, or B muscle cells, or B beta cells, and then to administer them locally, for example, to pancreas. It's a very good idea, yeah, to do it and have higher chances of increasing own insulin production. So at the moment, we don't have such capacity, but we are focused on the stromal vascular fraction, on mesenchymal cells in general, that can be in the body according to homing effect, will mostly concentrate and stay in problematic area. This is our, let's say, main basic idea on which we and other specialists in the world working with stem cells therapy, on which we are focused. I think in future, of course, it's more, it can be more beneficial to focus and to grow mesenchymal cells, precursor mother cell, into a special lineage to become special types of cells. Do you understand what I mean?
Yes.
So I think in future it will be, let's say, easier and more realistic to use these cells at a certain stage of specific differentiation. When it started the way of neuronal way, and in finally will become a neuron. Of course, it's very interesting and promising thing that many countries are working at this moment, especially with, let's say, damage of central nervous system, yes, accidents, etc. When really huge amount of neurons are necessary to fix the problem with, let's say, spinal cord or with brain after the stroke. And but I can't say that even at this age, probably in the United States it's more advanced, that even this technology brought at the moment nowadays great changes, made great breakthrough. So that's why it is in process of developing, like in our clinic. We are using only mother cell precursor without starting differentiation. We expect that this will happen like a main mechanism number one, if you remember, a mechanism when the stem cell will transform itself into specific cell according to the needs of the body.
But this doesn't happen when you inject them as mesenchymal stem cells for, let's say, children with autism. They don't become neural cells.
You see, according to the common data, yeah, that we have, it's about 10% that the administered cells can differentiate into this specific necessary tissue. For example, with autism, into neuronal cells, into neurons, 10%, but no more than 10%, not all amount, administered amount, but certain percent can, of course, differentiate themselves, like a mechanism.
Okay.
Yeah, and as for your question about exosomes, I haven't met such trials where it was a comparison between exosomes and precisely stem cells to tell what is more or less beneficial. In the body, in the therapy that is used in the whole world, mostly it is combination, because when we administer the stem cells, we told one mechanism, it's differentiation itself, another mechanism producing exosomes, so-called paracrine effect. The cells is in one place, but it produces these tiny vesicles which carry and deliver building materials and go to this area very easily. So it is like another mechanism of influencing, and in the body it happens with stem cells and with exosomes. Of course, now we and in the United States, because let's say with donors exosomes, it can't be the possibility of catching any infection or anything else. Probably because of some regulations, they use mostly exosomes, but to tell that is really much more effective than the stem cells, I'm not sure. I think its combination can be more beneficial. Combination, and in reality it happens, we do the stem cells, they produce exosomes itself, and plus we do additionally exosomes infusion or nasal spray, and it is also beneficial, especially nasal spray for brains. It works quite good.
Okay, thank you.
Thank you. And I'm sure that sooner or later, such trials confirming the just separately efficacy of the exosomes can be also found. If you want a very interesting article about exosomes, a recent publication, we can share with you via Shira. Probably tomorrow we will send it to you and you can read in details about exosomes as well. Go deeper.
Okay, thank you very much.
Thank you for your questions, Mr. Lior. My pleasure to answer. And if we return to patients with diabetes, then another person with a diabetic foot, I should mention, that had the diabetes for 12 years and took 3 different medications plus insulin and had diabetic foot with amputation of the 3rd and 4th fingers on the right foot. And after the surgery, after the stromal vascular fraction, A1C level improved, and this person could get rid of insulin, and the speed of healing of wounds became faster. And here even you can see the dynamics before treatment and after the treatment, the speed of regeneration of foot and the longer lasting damage of and wound problem that couldn't be solved for a long period of time with local administration of the stem cells, and on a systemic level you can see that speed of healing regeneration became faster. Yeah, especially after 1.5 months and finally 3 months period, like time points to achieve better results. Here it's a small joke. I should tell that mostly this presentation was done by my colleague, Dr. Svetlana. She's endocrinologist, and here is a funny anecdote about candies. How many candy bars Billy has eaten and what he finally got. Yeah, and the answer is about that he got finally, unfortunately, diabetes. So amount of carbohydrates which we use, how we use, it's also very important. I remember when I was a student, one story of endocrinologist. She told all the time, please, when you start your food, really, it's not good to start with some sweet things. So it should be some neutral products first, because starting with carbohydrates, with these things, it is like a stress for pancreas gland to start intensive functioning. It's better first neutral food and then some sweet things later. You understand, yes, what I mean?
Yes, we got the joke. I will remember this next time we eat together.
For sure. Yeah, for sure. For sure, Shira.
Okay.
So probably...
Is this it? Is this it so I can close the record?
Yeah.